Has your life been touched by dementia? Maybe you've experienced some cognitive impairment, or a loved one has? Dementia is a growing problem. Columbia University researchers found almost 10% of U.S. adults ages 65 and older have dementia, while another 22% have mild cognitive impairment. What are signs and symptoms to look out for? Are there ways to reduce the risks of dementia, even when you're younger? Stick with me to find out. Let's start with a lady who is probably a lot like your grandparent, parent, or even partner. Helen was a kind older lady who lived for her family. She cared for her grandson during the day for his entire childhood while his parents worked. He grew up as she grew older. She was kind, thoughtful, and considerate. She loved to garden, read, and travel. She was curious about the world and accepted all people. She had a wonderful childhood with caring parents, and family was the most important thing to her. Like I said, you know someone just like her. She lived with her family, so they didn't notice the changes at first. As she grew older, she would ask the same questions repeatedly. She would tell the same stories over and over. Sometimes her behavior would change so drastically that she was unrecognizable, from kind grandmother to unreasonable, combative stranger. At times, it seemed like her whole world was just herself. She didn't care about other people's feelings. These odd behaviors became more common. She stopped doing the things she used to enjoy and pushed her family away. Dementia is an umbrella term. It's the loss of cognitive functioning like thinking, remembering, problem solving, and language. We all forget things on occasion, brain farts, right? With dementia, the loss is to such an extent that it interferes with a person's daily life and activities. The most common type is Alzheimer's disease, about 60 to 80% of all dementias. Vascular dementia is the second most common type, but the two can overlap. Unfortunately, Helen's family chalked up her behavior to old age. Memory loss, confusion, repeating questions, changes in mood or behavior for no apparent reason, and not caring about others' feelings are all signs and symptoms of dementia. Other signs are difficulty speaking or reading and writing, wandering and getting lost in a familiar neighborhood, trouble paying bills, using unusual words for familiar items like saying bed for a table, losing interest in normal activities, losing balance, and problems with movement. Helen was my son's grandmother. She didn't get to the point of needing help with basic activities like feeding herself, but she grew sad and depressed. I'm sure she felt isolated and confused. What I didn't know then is that dementia is not a normal part of aging. Helen and too many people suffer needlessly. Why do I say that? The WHO identifies several factors that increase the risk of developing dementia. Age, more common in those over 65. High blood pressure or hypertension, high blood sugar, diabetes, being overweight or obese, smoking, drinking too much alcohol, being physically inactive, being socially isolated, and depression. Things like age, gender, and genetic predisposition can't be changed, but consider smoking and drinking too much alcohol. Those can be stopped. And what about hypertension, diabetes, being overweight or obesity, and being physically active? That can be fixed with a lifestyle change like 74-10 style. The 10 principles of 74-10 style are designed to prevent and reverse the modifiable risk factors of dementia, heart disease, obesity, and diabetes, with a bonus of cancer. By eating leafy green vegetables and the rest of the rainbow of colors of fruits and vegetables, whole grains, and legumes, you are giving your body and brain the energy and nutrients they need. By not eating meat or animal-based products, you are reducing the toxic load on your body and reducing saturated fat. Higher saturated fat intake is associated with worsening cognitive impairment and memory decline, as if the brain were 6 years older. By the way, saturated fat is in animal-based foods like cheese, ice cream, chicken, pork, beef, even seafood. By eating whole foods, not ultra-processed foods, you're giving your body and brain the nutrition they need to function optimally. And principle 8 is to move more, to exercise. Exercise helps our memory and cognition function. So 74-10 style, or any whole foods, plant-based, or healthy vegan lifestyle, forms the foundation for our bodies and brains' health. Sadly, Helen and too many patients with dementia did not have this. But what if food isn't enough? Not everyone can get all the vitamins and minerals they need from our food supply. A particular crop may not be nutrient dense because of an environmental reason, like poor quality of the soil, or your gastrointestinal system may not be able to pull out all the nutrients. Dr. Bruce Ames's work found that if you're even modestly deficient in one of the essential micronutrients, your body will prioritize it towards short-term health and reproductive capability and away from regulation and repair of cellular DNA and proteins that increase longevity. That longevity includes brain functions like cognition and memory. One area of research that shows promise is B vitamins to slow down brain atrophy, also known as neuron loss, and reduce our risk of dementia. In one randomized trial, B vitamins slowed whole brain atrophy by 53%, slowed atrophy of specific brain regions by 90%, and slowed or stopped further cognitive decline. I've talked about these two broad-spectrum micronutrients, that is, vitamins and minerals, that have been proven to help with brain health, especially anxiety and depression. They each have a randomized control trial to support their use, and there are over 50 research studies on them. Astonishing benefits to health have been documented in thousands of people. Here's a success story on the Hardy Nutritional site. Norma was diagnosed with dementia. Her doctors prescribed medications for some of her symptoms, which put her into a stupor. Out of desperation, her daughter talked with Hardy Nutritionals. They worked out the dosage for their daily essential nutrients. In only 3 days, there was a drastic difference. Norma was coherent again. Soon she was able to go back to her usual way of life. That is amazing. I wish I had known about this for Helen, but now you know. All right, what if all else fails? The last option should be medications. And medications can temporarily improve dementia symptoms. Some boost levels of a chemical messenger involved in memory and judgment. Another regulates a chemical messenger involved in brain functions, such as learning and memory. A new drug is in phase 3 clinical trial for slowing cognitive decline in people with early Alzheimer's disease. But there is a price you pay with all medications, from immediate side effects to long-term impacts, and they don't heal you, only slow down the disease. So please discuss the benefits and consequences of any medication with your doctor. We don't have to suffer from dementia. Living 74-10 style forms the foundation for our bodies and brains' health. You benefit, animals everywhere benefit, and the planet benefits. What is one step you can take right now to improve you or a loved one's brain health? We'd love to hear. Drop it in the comments below. Hey, thank you for your time. We really appreciate you. Please like, share, and subscribe for more. Our weekly email newsletter, 7410 Expanded, is free. Here's the link. Dementia is not part of the normal aging process. And remember to take it one day at a time until it's 7 days a week, forever 10.